Welcome to Radiopedia's quick guide to acronyms. Whether you are a seasoned radiologist or you are just starting your journey in the world of medical imaging, knowing how to use acronyms can elevate your cases and articles. Acronyms are commonly used in medical literature to simplify or streamline communication. However, it is essential to use them correctly to ensure clarity and understanding. Radiopaedia follows specific guidelines for using acronyms. Accepted acronyms included those medical conditions, anatomical structures, and imaging techniques. For example, MRI for magnetic resonance imaging and CT for computed tomography. Avoid using acronyms that are not widely recognized or understood. These can lead to confusion and misinterpretation. Instead, opt for commonly accepted abbreviations to enhance clarity. By following these guidelines, you can elevate the quality and effectiveness of your cases and articles. Thank you so much for your time, and we look forward to seeing your contribution on our edit list soon.